Can I continue seeing my doctor? Is one of the first questions employees ask about their health insurance plans. As an employer, the answer you give depends on the network in your benefits plan. If you have an open access plan, employees can generally see the providers they know and love without added fees or red tape. This can be where open access plans can benefit. In essence, open access healthcare insurance means employees have more freedom to see the healthcare providers they choose. Employees don't need referrals from a primary care physician to see providers, and they aren't bound by in-network providers. In-network providers contract with the insurance carrier, charging a set price within carrier limits for services. Open access healthcare insurance is also known as an open access plan, or referred to as having an open access network. You'll additionally see the term open access provider. This refers to an insurance provider offering healthcare plans with an open access network. Open access plans do not mean anything goes. In fact, depending on the plan, they can vary in degrees of openness. Two common variables include the size of the open access, whether employees can avoid referrals for in and out of network providers or just for in-network ones. The exceptions. Which special services, treatments, and/or procedures still need authorization from a primary care provider before an employee can proceed. Employees with open access plans pay copays based on the employee's plan specifics, the services provided, and whether the provider was in or out of network. It's worth noting that emergency treatment doesn't fall into these definitions. Employees can always seek essential treatment without needing a referral first. While researching how open access plans work, you probably read that HMOs, Health Maintenance Organization, and PPOs, Preferred Provider Organization, based on your health insurance coverage. As an employer, you can find open access plans across a variety of plan options. Self-insurance plans and fully funded plans can both include open access networks. But before we try to break down what open access looks like, here is a review of some recent stats from 2020. 47% of covered workers have PPO plans. The enrollment rate in HMOs was 13% of all covered workers. There were significantly fewer covered workers enrolled in health maintenance organizations in 2020 versus 2019, 13% compared with 19%. Open access HMOs are less expensive but more limiting than a PPO. However, PPOs are, by definition, open access. They are more flexible in which providers you can see, but you pay more than you would in an HMO. Sana's PPO Plus plans offer all access or open access, meaning you're never restricted by a network, forced to pay out-of-network fees, or required to get a referral. You can see any doctor you want, anytime, and enjoy modern benefits for you and your employees.